John, good to see you. Thanks for coming in. Dr. Rosamelia, always good to see you. Thank you. Please have a seat. This should be fine. Hello, and welcome to the House of Delegates 2025. I'm Marty Ranowski, CEO for the Pennsylvania Medical Society. And once again, it's my pleasure to be here with you as we set policy for PA Med this year and for years to come. But with me today, I have Dr. John Mantione, Chair of the Pennsylvania Medical Society's Board of Trustees, and Dr. Lorraine Rosamelia, who's our Vice Chair of the Board of Trustees. And today we're going to talk a little bit about what PA Med has been doing over the last year and what we see in 2026. So with that, welcome, Dr. Mantione.
Thanks, Marty.
You know, in one or two words, how would you describe what PA Med has been doing in 2025?
If I had to use one word, I think the word that comes to mind quickly is involvement. We've been staying involved in many areas around the state and trying to coordinate how the medical society interplays with that. We also look at where we are in the advocacy world, where we are in the education world, or CMEs, as well as education of our patients. I also see we're involved in how do we navigate through the change in the federal landscape, local landscape, as well as the state landscape.
You know, Dr. Mantione, I love that you talked about our three pillars. And it is, educate. And it's educating your colleagues, our members, and it's educating patients. It's advocating for them because there's so much happening. And it's navigating through these difficult waters. Dr. Rosamelia, how have we been advocating for physicians and, quite frankly, for their patients?
First of all, PA Med, if I were going to pick one or two words, I think the word would be voice, because it would touch on all the pillars that both of you discussed, but also the subgroups within PA Med's staff and leadership that help us get to the big stages, like Capitol Hill, like Harrisburg, like subgroups within the AMA. They're trained so well and keep their ear to the ground so well that we find that the voice of PA Med is always there.
Speaking of being involved, and Dr. Rosamelia, we've done a number of joint advocacy campaigns, and we've done amicus briefs. So we seem to be doing amicus briefs all the time because we're a state that likes medical liability cases, although our members do not. How do these, can you tell us a little bit about the advocacy wins we've had with those, and how is that helping patients and physicians?
I think to come back to the point where we have a great team of staff and physician leaders, but also legal and advocacy teams that keep their ear to the ground. Basically, Pennsylvania is a place where medical liability and some of the cases that cost physicians, practices, hospitals money, it is a giant problem in Pennsylvania. And so if our teams are at the table and also pair with national organizations like the AMA so that there's funding for the amicus briefs, it means that our name is on something that says this isn't fair. A patient did not get what they needed. A physician was punished for something perhaps that they did not do. Or we see these stains that create an environment where doctors might not want to work in Pennsylvania. And so pairing with national organizations to be part of those voices is important.
There's been some discussion lately around, the potential of PA Med having an annual meeting around the House of Delegates. Can you elaborate a little bit on what those discussions have been or where that is?
Yeah, so the speakers have brought back to the board and asking for how do we best do what the House is asking for? And how do we expand and make this a more inclusive meeting about hearing voices and exposing more people, again, in that marketing sense, to what PA Med can offer and what is out there. So there's initiative now that we are going to look and survey, poll, get information from non-members, from members, from delegates, from board members and leadership to see what is the best avenue and how best to do that so that we can wisely spend the money to do that, as well as have that venue for many, many voices, as well as shaping policy and the informed opinions and input into what the delegates want, what the resolutions are looking for, and going from there.